Hi, this is Palaniamal, nurse educator at Dr. Mehta's. In this video, we shall learn about nasogastric tube insertion in newborn. A nasogastric tube is a long, thin, hollow tube which is passed through a nostril of the nose into the throat and down into the stomach. What are the purposes of nasogastric tube insertion? Infants who are unable to feed orally and will be fed by continuous or intermittent gavage feed. Infants who require gastric decompression and who require gastric lavage. Nasogastric tube is indicated neonate who can't feed orally, preterm babies that is less than 37 weeks gestation, low birth weight babies less than 2.5 kg, neurologically depressed and surgical neonates. Points of emphasis. Pass the gastric tube gently so as to avoid trauma. Passage of the gastric tube may lead to stimulation of vagal nerve, resulting in apnea, that is cessation of breathing, and bradycardia, heart rate less than 100. If this occurs, tactile stimulation will assist infant to breathe. Let milk flow under gravity. Pinch tube while filling syringe. Feed slowly and pinch tube during removal. Equipments required for nasogastric tube insertion are feeding tube. For an example, 6 French feeding tube we can use for 2000 gram babies. Then appropriate size syringes like 5 ml and 10 ml syringes, stethoscope, scissor and tape. Now we will see about the nasogastric tube insertion procedure. Wash hands thoroughly. Position the baby on right side or in supine position with the head end elevated. Baby may also be held in sitting position in parents' or nurses' arms. Open the feeding tube package and starting at tip of the tube, measure from the bridge of the nose to the tip of the earlobe down to the tip of the xiphoid process. Mark the tube with tape or maintain measurement with thumb and finger, as this indicates the approximate distance the tube must be passed to enter the stomach. Hold the feeding tube 1 to 2 inch from the tip. Use the natural bend of the tube to follow the natural curves of the nostrils. Insert the tube in the nostril, gently pushing it down the esophagus until reaching the pre-measured mark on the tube. Use distilled or sterile water to lubricate. Don't use oil or paraffin to lubricate the tube. How do you confirm the tube? Establish correct placement of the feeding tube by either of the following methods. First method is connect the syringe to other end of feeding tube and gently aspirate the stomach contents. It may be necessary to advance or withdraw the tube slightly from its original position. Note the amount, color and appearance of the aspirate. This aspirate is usually refilled. The second method is disconnect the syringe from feeding tube and draw up 2 cc of air. Reconnect the syringe to the tube, inject the air into the stomach while auscultating. You should hear the air enter the stomach. Gently aspirate air before connecting a feed. Observe the baby for choking, gasping or cyanosis during insertion of tube. Withdraw tube immediately if baby appears to be in any distress. Tape the tube in place or always keep one hand on the tube at pre-measured mark to prevent the tube from slipping. Thank you for watching this video.